Autism is defined by the Autism Society of America as a complex developmental disability that typically appears during the first 3 years of life and is the result of a neurological disorder that affects the normal functioning of the brain, impacting development in the areas of social interaction and communication skills. Both children and adults with autism typically show difficulties in verbal and nonverbal communication, social interactions, and leisure or play activities. Autism is one of 5 disorders that falls under the umbrella of pervasive developmental disorders, PDD, a category of neurological disorders characterized by severe and pervasive impairment in several areas of development. Significant problems in language development, significant problems with understanding and engaging in social interactions, inconsistent sensory response patterns, for instance, periods when hearing appears to function normally and periods of apparent deafness, uneven pattern of intellectual development, significant highly focused restriction of interests and activities, insistence on sameness, resistance to change, difficulty in expressing needs, using gestures or pointing instead of words, repeating words or phrases in place of normal responsive language, laughing and or crying for no apparent reason, showing distress for reasons not apparent to others, preference to be alone or in an aloof manner, tantrums, difficulty in mixing with others, not wanting to cuddle or be cuddled, little or no eye contact, unresponsive to normal teaching methods, sustained odd play, spinning of objects, obsessive attachment to objects, apparent oversensitivity or undersensitivity to pain, no real fears of danger, noticeable physical overactivity or extreme underactivity, uneven gross and fine motor skills, non-responsive to verbal cues, acts as if deaf, although hearing tests are within normal range. The classroom environment should be structured so that the program is consistent and predictable. Students with autism or PDD learn better and are less confused when information is presented visually as well as verbally. Interaction with non-disabled peers is also important, for these students provide models of appropriate language, social, and behavioral skills. To overcome frequent problems in generalizing skills learned at school, it is very important to develop programs with parents so that learning activities, experiences, and approaches can be carried over into the home and community. Students with autism may prefer visual directions or instructions instead of verbal ones, may find it easier to answer questions given choices versus open-ended options, may have difficulty organizing information in routines, may need to be asked one question at a time, eliciting a concrete answer, may vary in level across domains, may excel in one area and have deficits in another, may be able to work in a general education curriculum without modification, or may need a modified functional curriculum, may not learn from lectures, may need visual lists, icons, and repetition to learn, may use rote memory to recite a fact, but have challenges in drawing inferences, sequencing events, understanding and interpreting cause and effect and character motivation, and using prediction and other complex reasoning skills. They may miss presentation of content information because thoughts are elsewhere, and, being unaware that the information has been missed, they may fail to seek it out. They may know something in one setting, but not another due to failure to generalize. Here are some common requests that might be made by parents of children with autism. My child needs structure and routine in order to function. Please try to keep his world as predictable as possible. If there will be any sort of change in my child's classroom or routine, please notify me as far in advance as possible so that we can all work together in preparing her for it. Teaching strategies intended for children with autism will help my child learn better and make him easier for you to deal with. My child is an individual, not a diagnosis. Please be alert and receptive to the things that make her unique and special. Please keep the lines of communication open between our home and the school. My child needs all the adults in her life working together.